Thank you all. Thank you so much for having me. So yeah, I um, was introduced by Lori, and the reason was I had a problem with my shoulder. I had been seeing a chiropractor like for 5 months, going every week, just in pain, having pain. And she put the ice wave on me, and my pain was like gone. So I was like, okay, what do I do? Like, this is amazing. And so I started out with the X39 and the ice wave, and for my shoulder pain. And I would even, when you have pain like that, like you'll feel it at night too. So even though I would take the patches off at night, I would still, feel it, like I wouldn't be able to roll over on that side. So that all started to dissipate the pain in about 2 weeks of wearing the ice wave. By about a month out of wearing the X39 and the ice wave, my pain was completely gone. And so I didn't have to wear the ice wave anymore. I was able to go back to all of my exercises that I had been doing before that I had to totally back off on, for that 5 months that I had been in before that. So that was really amazing. Also with the X39, like within the first 4 days, by about 4 days out, I started feeling more energy. And I thought, oh, I don't know, we'll see. But by 7 days, I knew that I had way more energy, felt so much better. It was just totally amazing. So I was so happy with that, with the energy part, because normally I could just sit down at any time during the day. If I would sit down, I would fall asleep. So, I mean, it was just, there was no way to keep my eyes open during the day. Whereas now, that's not the case. Like it's unusual for me to take a nap. Even if I do sit down to read a book or something like that, like normally I would just be totally out. And that's not the case. I can still stay focused on whatever I'm working on without feeling like I can't keep my eyes open. Um, okay, I wrote myself notes so I could remember. The working out too, I work out like 6 days a week. That's just part of my life. I love that. That's my background is in that. And I was always sore. I mean, like just lactic acid buildup and all of that. And really, within the first couple of weeks, I noticed that the lactic acid would just completely dissipate and I was no longer sore. Like I would have to really push myself even harder to feel it. And now I've had an injury. I tore my Achilles tendon in June and had surgery on it. But now, even now, with doing PT and all the hard stuff you have to do to try to recoup that muscle, I'll just be sore the day of, but then the next day it's amazing because it just is just completely, the lactic acid is gone and dissipated. So I love that. To not be sore is such a gift because it really hurts sometimes, especially when you can't sit down on the toilet to go to the bathroom. So that's fabulous that.
What airline are you using? Get
Sorry, what?
out.
Oh, maybe she's not asking me a question. Sorry. Um, I don't have to get up at night anymore to go to the bathroom. I probably noticed that at about 2 or 3 months.
No,
That
I know my eyes still aren't focused,
um,
and we were trying
I could
to
not walk on
on the
hard floors
computer, and
without
I
shoes.
see I can't.
I would have a lot of pain in my
It's
ankles and in
frustrating
my
because
knees
I get
after
myself
walking on my hardwood floors all day and
upset.
tile. That has completely gone. I can walk around barefoot and not have any pain anymore. So that's a huge blessing. Um, Oh, I couldn't I would have all this tingling when I would sleep at night in my hands. My hands would go numb and so it would wake me up at night. All that tingling went away probably within about 3 months. Like I couldn't even sleep. Like if I would sleep on a pillow, my neck would go numb and that would wake me up. That's all completely gone. I would go to the hairdresser and I would lay my neck back to get my hair washed, my neck, and it would like run up the top of my head, like my whole head would go numb. And so, my hairdresser was like, "Oh my gosh, if your head's not going numb anymore, that's a miracle." Like that was crazy. So I was super, because that's kind of freaky. That whole feeling was like super freaky. So that's all gone now. So I was super happy about that. I have had back problems pretty much my whole life. And I would like, I just call it throwing my back out. Well, when I would work out and that would happen, I would pretty much be out for a month. Like I would have to basically just go in and walk. Like I couldn't do anything but walk on the treadmill or walk outside, and I would just have to wait for like a month for it to finally release. And the first time that happened, I think I was about 4 months in with the patches, and I did the whole pain patching, and the video, I just followed the video on that, and by day 4 my pain was completely gone. Like I you don't expect that when you've dealt with something like that your whole life. And so that was just totally amazing. And then it happened again, um, to me as well. And that time I did the, whole pain patching again. And in one day, I was complete. I went to class the next day, like like it never.
Find out some.
So that was also something that was really amazing. Um, and then like I said, I tore my Achilles tendon at the first part of June. And, you listen to all these testimonials, you see people's pictures, but I don't think you believe that it's going to like happen to you. And my scar was pretty much, you couldn't even see it at about, I think, 6 or 7 weeks. Like I have pictures, you can't even hardly see the scar. Like my doctor and my physical therapist were all like in shock at how, I mean, they couldn't even believe the way that the scar, I mean, you can't even tell. Like if you were looking at me from behind, you wouldn't, I mean, and it's probably 4 or 5 inches. So, I mean, would have been able to see it had you been looking at me, and no one would even know that I had, surgery like that, total rupture, and had to have it completely repaired. So, um, anyway, so that's kind of me, like, and what I've experienced with patches. I do just want to tell a little bit about my husband because I think his story is probably even more important than mine, just from the standpoint of he's been using the patches as well for 9 months, but he feels absolutely nothing. He has no results in his symptoms. He does not notice them at all. And the only reason that we know that they're working is because we've had tangible test results. So, with him having high blood pressure, he can test his blood pressure at home. We've watched that totally come down using the X39, X49, carnosine, and Eon. And so that's been just, huge for him, but it's not like he feels anything in his symptoms. The other thing is that we did a heavy metal detox on him, and he tested high for toxic for mercury and arsenic. And there was a 4-month protocol, just with supplementation for it to pull those metals out. And he's bad about taking supplements. I know a lot of people struggle with that. And so the patches are way easier, so much easier to slap a patch on than to make sure you're getting all your supplements in. And so he did 1 month of the 4 months. And I didn't know that when we went back in to have him retested, but he'd constantly been wearing the glutathione patch along with his other patches. And so we get the test results back, and his numbers completely went back into normal. So that was totally like shocking that that the numbers would come down like that. And he had only done 1 month of the 4-month protocol of supplementation. So the only answer was that it could be the patches. Anyway, I just think his is so important because I think that people get stuck on, well, I don't feel anything, or they're not working for me. And if they don't have a measurable, test result, or if they don't look at the science, like if they actually look at the clinical studies or go research, some of the, carnosine, glutathione, DHKCU, AHKCU, if you don't research those on PubMed, you don't understand like what they're actually doing for your body. And so I think it's really easy for people to just decide they don't work for them, versus, the knowledge of, no, it actually is. It just may be that for whatever reason, you don't feel it. You're not feeling it, but it absolutely works. It always works. It's always doing something in your body, and having some type of measurable test results can be very helpful for people to keep them encouraged. But I'm excited for the day when he feels it in his symptoms, and that's going to be fabulous. But I'm super thankful for his story because I just think it's important for people to know that you may not always feel something, and it may take a long time for you to get those results because you've been in whatever state you're in for a long time. So to do something naturally and to help your body do what God designed it to do, completely naturally, is, it could take you some time to see something in your symptoms. So
Yeah, I can absolutely back that up for sure, Nikki. Like just, being a practitioner for 23 years and, you know, testing many, many, many people for and seeing based on those test results that they had stuff going on that they were not consciously aware of. They had like no awareness of it. And, the good thing is that we had that information so we could see what needed to be worked on before it manifested physically, before it even manifested into symptoms. But we had that information. So anything that we did introduce, whether it be, like you said, like supplements or these patches, you can see over time changes occurring, because things are happening below our conscious awareness all
For
the
sure.
time. Yeah, yeah. That's how disease develops, where you don't really have any symptoms until it's kind of a threshold thing, right? So you don't have any symptoms until you hit that threshold of awareness. But it's happening up into that point, right? And or something happens that changes that threshold. So that's why I'm always telling, anybody that I'm working with that's either using the patches or somebody that's introducing another person to the patches is, the more information that we have, the better to go on. We can't always just rely on conscious awareness as to like what's actually happening in the body where the patches are concerned, or really anything for that matter. Um, some people are more sensitive as to what's
Eso
going
cambia ese umbral. Por eso siempre
on.
les digo que conocen a alguien con quien estoy.
Sorry, I had to mute someone. Some people are very conscious aware of what's happening because they're very sensitive. Some people, we have different levels on our thresholds. So that has an effect as well, how it can be different for some people versus others. But if you have a way to measure things, that's really helpful, you know. I thought it was amazing when I saw your testimonial pictures of your injury and your scar that you shared with everyone. Oh my gosh, that was amazing. Yeah.
Yeah, I'm super excited. Yes.
Yes. I mean,
Because
of
I
course,
have
I don't
other
want you.
scars, I have other scars from other injuries, from back in high school. And, they're still residual, you can notice them if you're looking for them. But this you would never even notice that I, had surgery in June. Yeah.
Yeah. Yeah. I mean, it's just a testament, right? Like, I'm always trying to set people up for success where any kind of surgery is concerned, because obviously if you're doing surgery, that's something that's planned. You can be very proactive to prepare somebody for having a surgery. When you have an injury, that's a little different, right? Like, it's not something that you expect. But whatever kind of condition your body is going to influence, kind of what happens as far as your healing capacity is concerned. Anytime you have an injury or surgery, and how you handle those things from that point on affects so many things. So I'm always a proponent for setting people up for success nutritionally, and the patches are tremendous, right? Because the X39, that's the big one to help with healing. Eon is great to help with inflammation, help activate that parasympathetic side of the nervous system, which you need for healing as well. Ice Wave is excellent for pain. And there's so many things, right? And things that we can use in combination. So definitely have been very grateful to have the patches, and love hearing your testimonial of just like it's benefited you in ways that I think it sounds like that you didn't expect.
Yeah. And the other thing that I would say that, I think that especially like when you've been wearing them, for so long, you kind of have a feeling sometimes of, well, I don't know what they're
¿Qué
doing
más?
now because I'm not having, I'm not really seeing anything else, or, maybe I'll feel a little bit tireder or whatever. But yet I, remember that, before when I would sit down, my eyes would just close and I would be,
I think
go to
September
sleep,
1st, George.
super quick. But now, that's not the case. And so that too is just knowing that even though I'm not constantly now feeling anything or any changes, I know they're still, working in my body to, regenerate and repair other parts that I just may not notice yet. So, Just, just knowing that they're constantly, working and doing stuff. I'm super thankful for that.
Well, and that's a good point. And I appreciate you sharing that, because I think, like you said, a lot of people are not always, thinking from that perspective. And I think sometimes, like, have you ever done that where you've taken a picture of yourself and then 6 months to a year go by and then you take another picture and you're like, then you notice from
Right.
a kind of an external perspective, you're like, oh, wow, like I do, not even just how you're functioning, but how you look, how your skin looks, how things look. Like it definitely can make a difference with doing something like that as well.
Yes. Yeah, and
Mhm.
I have actually had people comment on my skin as well. And so that's, been kind of shocking as well, because I don't know that I really see it, even though like I've taken the pictures and stuff. I can't say that I see it, but when somebody comes up and asks me, what are you doing? Your skin is glowing, like what you're doing something different. I'm like, oh, they are my it is working on my skin. This is great,
Exactly. Exactly. Yeah, you have amazing skin, beautiful skin.
Thank you.
Yes. Well, not, and that's when you go, oh yeah, it's X39,
That's right.
Alavita.
Yes, for sure.
Yeah.
Yes.
Make sure that they know that that's part of what you're using. Absolutely. What have you noticed as far as like, introducing it to other people? Well, you mentioned your husband, so that was really good information.
Yes. I so many things. I mean, I'm sure like all of like it's just, even to the point of people's joy, like having someone like that just so touched me when someone said, I was ready to go home and be with the Lord, and now I have these patches and I have, I just am experiencing so much more joy. Like I feel like I want to live again. I mean, like that's like make you want to cry, like,
Yeah.
oh my gosh, to affect someone in such a way that it truly affects how they feel about their life, that was just so, heart touching. Watching someone who has a hand tremor and, it catch them and immediately like their hand is not tremoring as much as it used to. People in back pain, having back pain go from an 8 to a 4, when putting on, ice wave or something, hip pain. I mean, just, so many things. To be able to have something that, makes a difference in people's lives is just one of the greatest joys. I'm so very thankful, very thankful to be a part of something like this and with people who just care so much about other people. It's just, I'm just so thankful and, every time I meet someone new, especially, in this business, I know they all have that same heart and just want to help people and make a difference. So it's just
We
such a
love you. We're lucky to have you. LifeWave's lucky to have you. We love you so much. Yeah, it's definitely, I agree 100%. Like there are people, if there's practitioners on this call, I just want to tell you, I've had patients that uh, are highly sensitive to any kind of chemical approach, whether it be supplements or medications. And we're talking extreme asthmatic. And it's been life changing for her. These patches have been, because to be able to influence the inflammation in your body in a non-chemical way, for a lot of people, like you said, it's life changing. Because I think, yes, okay, we have those other ways to influence that, but not everybody can do that. And there's a lot of people that there's contraindications to, mix certain medicines, or they might have some organ impairment that affects their ability to take over the counter pain meds, in addition to maybe some of the other stuff that they're taking. So I think it's amazing that we have a tool like this that we can introduce and other people to, that we can introduce. It's something that we have in our kind of like arsenal to help people of the world, to help patients that may not have, those alternatives as well. So I've definitely seen that. There's a lot of people that, they have metabolic impairment and they just cannot process, a lot of different medications very well. And so, this is a great thing to have to be able to use with people. Absolutely. So thank you so much for sharing your testimonial with us,
Thank
Nikki.
you so much for letting me. Thank you.
Yeah, it's super powerful.